Support for the Capital Connection comes from New York State United Teachers, working to support students, educators, and public schools as the center of their communities through the Public Schools Unite Us initiative, and United University Professions, representing 37,000 academic and professional employees at SUNY campuses and teaching hospitals across New York State. Frederick E. Cole, President, uupinfo.org. It's the Capital Connection. Hi, I'm David Gustina. Back with us is the New York State Comptroller, Tom DiNapoli, a Democrat. Tom, welcome back to the Capital Connection.
David, it's always great to be with you. A lot going on these days in the Capitol and all across New York State, so it's a great time to chat with you.
It certainly is. The budget wrangling is currently going on as we speak. You were a state assemblyman for many years. You know how that process works. And back in the day, Tom would say it's three men in a room making all the decisions, and the rest of the lawmakers are sort of left out of the final decision-making process. Well, it's no longer three men in a room, but it is three people in a room. You have the governor, Kathy Hochul, you have the head of the state Senate, Andrea Stewart-Cousins, and you have Carl Hastie, the speaker. Is the negotiations any different now, or are they still doing like they did it in your day?
Well, of course, I'm nowhere near the room these days being the controller, so I can only reflect on more of, kind of the echo chamber of what I hear. I'd say it's similar to many of the years that I was there, where, especially when you would blow through the deadline, of April 1st, the conversations became more intense at a staff level and at a leadership level, but the members seem to be less and less aware of what exactly is on the table. And, I think that makes it a challenge for the members who really are there to, fight for their constituency, fight for their important issues. It makes it tough for the press to be able to report on, what's real in terms of because, of course, at this point, the options will be narrowing and, the choices will be narrowing because they are trying to close it down. But if the press isn't aware of what the details are, that means the public isn't aware. So the opportunity for the public perhaps to react to some of the options that are being considered becomes much more limited. I have to say there were some years where there was more openness than others. When I was in the legislature, I do remember there was a time where the conference committee process, in its beginnings was, really pretty active, and members, majority and minority, both houses would sit together and come up with recommendations, to leadership on budget allocations, and there was more direct member involvement. That seems to have gone by the wayside. So, we are, into the first week of April. We also know, David, that in Albany, things could get done very quickly when there's the, momentum to close down a deal. I hope that happens. The uncertainty for local governments, for state employees, when a budget process stays open for more than a couple of days, creates a lot of anxiety. So let's hope we can move forward sooner than later.
It sounds like, at least from what I heard and reported on from Carl Hastie, the speaker, is that they're closer. They're in the same state, he says. They've moved from the same planet to the same state. He's not sure if they're on the same block yet. Yeah. But the big issues, education, right, and health care are huge issues that have to be decided on. Also, housing is another big one, and that's one that you've been harping on, Comptroller DiNapoli.
The issue of affordability of housing is key. The governor, as you know, last year put forward a strategy which really spoke to requirements or mandates on local governments with regard to housing, and there was a lot of pushback against that. So her strategy this year, which I think is one that actually makes more sense, is to really talk about incentives for local governments to address this issue. And I know her hope is that something gets included in the budget to deal with this. I mean, you do get back to that issue, right, of to what extent do you have a budget laden with policy choices? And that seems to be what often happens in Albany, as you know, over the years. And sometimes that's part of why a budget gets held up, because it's not just straight on the numbers. But look, our reports, show that the big difference between New York and so many other states when it comes to the housing questions, we're not creating the supply. We are behind so many other states in terms of just creating the supply. Easier said than done. Some of it has to do with financing. A lot of it has to do with local zoning issues and approval process. So, I think everybody agrees more needs to be done. The devil is always in the details. You have, for New York City, you have that big issue still of the 421A program, to what extent that should be renewed or not renewed. The industry has the real estate industry has a lot to say about it. Labor has a lot to say about it. I mean, that whole New York City issue is one, and then of course through the rest of the state, an area where I live, Long Island. I mean, housing really has been a big issue. What the governor really has put forward is to say that she wants communities to designate themselves as being pro-housing, and then they would be eligible for incentives in terms of state programs, state financing, infrastructure investment. I think it's a smart strategy, and she's putting her proposal has some money behind it. But I'd also say, you mentioned education and healthcare. Education and healthcare are the two. By healthcare, we mean the Medicaid program. By education, we largely mean school aid. Those are always the two biggest ticket items in the budget. So no surprise that they would be the two areas where you'd probably have the most debate and discussion. On education, the governor, while she increased the funding on school aid, it's at a more modest level than you've seen in more recent years, where there was a strong commitment to fully funding what they call foundation aid, obviously taking advantage of the federal money coming down. And I think she was realistic to say, we're in a slightly different position right now. But the detail in terms of how the aid was being distributed is, I think, what has been causing some of the holdup. Because by changing some of the formula calculation on foundation aid, a number of districts actually would see a reduction. Something like the hold harmless or save harmless provision that's been around for a long time, which basically said a district would not receive less money than they did the year before. In the face of declining enrollments in a number of districts, the governor is suggesting a different strategy. That's been very controversial. Medicaid, a growing area of expense, a lot of people in need, long-term care. But the governor has really tried to say we need to do a better job of controlling some of those costs. And again, you have a lot of interest concerned about that, both the healthcare industry, some of the unions involved. What we've always said in the Comptroller's office, we think it's not just about adding money or cutting money. It's about being smarter with how we spend the money that we have. David, and I know we've discussed it in the past on the show, we do audits all the time on the Medicaid program, often pointing out ways in which money could be saved, spent more wisely without hurting services.
And Tom, I spoke recently with Will Barclay, the Assembly Minority Leader, right? Mm-hmm. And I told him that you had said, I put out all these reports, and I said, you Republicans are always trying to watch out for fraud and abuse and make sure you're doing things the right, debt reduction the right way. And also, I said, well, the Comptroller is sending you reports all the time about Medicaid. Are you guys reading them and trying to implement them? Because it doesn't seem like you are. And he said, you know what? I got to look further into that.
Well, thank you for being our advocate.
But it's true. I mean, you are doing some of these reports. You are suggesting. But the real issue is anybody reading them and implementing any of these strategies?
Well, I think it's reflective of the audits we do, not just of state agencies or programs like Medicaid, but all the local government audits as well. We don't have any enforcement authority. The way the system is set up, we provide independent oversight. We make recommendations. It leaves it to the powers that be as to whether or not they choose to implement those recommendations. So I would hope that they would, on the Medicaid front, we identify really literally hundreds of millions of dollars of cost-saving opportunities, revenue enhancement. Again, that doesn't hurt services. it would be nice if they dusted some of those reports off and implement it. So thank you for fighting for us. I appreciate that.
Well, you're right. Enforcement's always the issue, isn't it? When it comes to setting rules, will you enforce them? Do you have the personnel to enforce them? Also, there seems to be a patchwork that's going on. I talked with Hunger Solutions last week about, trying to get free meals for all school students who need them in the schools. And New York's done a lot to that end, but it hasn't really finished its work in many communities across the state, including on your own Long Island. And the issue becomes a patchwork because in the law, for example, a family of four making $56,000 a year does not qualify for their children to get free school meals. Now that is because it's right on a line. You had to drive the line somewhere. So there's, again, the donut hole. And you got the same thing with the school and education. You say think smarter. So then why are we funding schools through the property tax system, which means poorer areas are going to get less money? And then you have ideas like taking away hold harmless, which again seems to me to be a patchwork. Why aren't we thinking smarter?
Well, I think on the issue of how we fund schools, it's been, from my point of view, the big unresolved issue. I think, and it's different obviously for a place like New York City because they have a different funding structure. But for outside the city, for most districts, it is the property tax, right, that carries the bulk of the burden. And the inequities, as you point out, are there if you're a low wealth district in terms of property value. And in terms of people complaining about tax burden, when they look at their property tax bill, you can complain about your village or your town or your county, but the bulk of that really is on the schools. And
if you don't have kids in public school at that moment, those are the people that really complain, even if they were educated in public schools.
I hear about that when I was a legislator. I heard about that all the time. And I don't think the property tax was ever set up to be the prime source of funding for schools. But when you talk about changing over to an income tax base, you get into that issue of, is it collected statewide? Do you do it regionally? Right? Do the counties have an income tax? And you get into the question of who distributes the money then, and then you're back into the issue we have right now, with the debate over the formula. So imagine if you put the whole education funding on a broad tax, and that's I think a big reason why you have the dilemma in terms of resolving it. But it is the perennial issue. The issue is distribution of the money, however it's collected, and the issue continues to be how it's collected. And I, as long as I've been around, there's never been a clear solution to it. My own view, putting my legislator's cap on, I think there is a way to increase the school funding through the income tax, maybe even having a very clearly defined separate tax on income for education. Have as much as you can, a level amount of funding based on student population and student need, and then provide an opportunity, because I don't think you can totally take away local control, for districts that would choose to and hopefully have the resources to spend within a cap, within a limit, so we don't have too much variance in terms of the money that's going behind each child's education. Have a local option to raise money, probably through the property tax, beyond what the general state support would be. There have been proposals to do that. They had a little bit of steam back in the 80s, but you haven't seen much interest in doing that kind of major overhaul. Maybe one day it'll happen. Not going to happen in this year's budget negotiation. It's really going to be a discussion of how the aid is distributed and how much it's going to be. But look, one thing I can tell you for sure, without knowing the numbers, the legislature is going to add more money to the school aid to what the governor proposed, and I think that'll be an important part of closing down the budget.
Well, I heard an argument recently, just to extend this just a tiny bit further, about funding for schools. It came from Heather Bruschetti from the Business Council of New York State, and she said that, and we've heard this argument from the Republican side a lot, that, it's not just throwing money at the problem. We are one of the states that give the most money to education of any state, and we don't get the same outcomes as a lot of other states. Is that true, Tom? I mean, how do you answer that question when it comes to the financial part of this? Are we giving per dollar and not getting a return? I mean, I don't know how to answer people when they make that argument.
It depends how you measure it, right? We have some of the best schools in the country, and we also have some of the most challenged, populations, in terms of disadvantaged students in the country as well. So, I've heard that criticism, but good education doesn't come cheap, and I don't think anybody should, try to argue that it does.
Yeah, especially when many of those people's children are going to expensive private schools.
Yeah, well, I mean, that you're absolutely right. But I'm a product of public education. My parents were as well.
Me too.
It made the difference. And hey, my grandparents were immigrants. They came here with nothing. Certainly not with an education. So it was in the American public school system that my family was able to be on a path of mobility into the middle class, and I still think that's the case. And you get into other arguments, you have the option, not only, you mentioned private and parochial schools, but you have charter schools now, which not something that existed when I was in school. But at the end of the day, the public schools are still required to take in everybody. It's not a question of choice. That's a right, and that's a good right. But, in our public schools, you're more likely to find students with special needs. Just this week,
Absolutely.
we've been celebrating Autism Awareness, right? You just look at the significant increase in diagnosis of children with autism and the added challenge that provides, as far as inclusion programs and so on. So, hey, I mean, New York, to its credit, I think does a much better job of providing for students with special needs. And is that part of what drives up the cost? Absolutely. Do we work hard to have our educators be well compensated because we want people to see teaching as an attractive career option? Yeah, we do. But that is gonna cost money. It is our most important investment, though. And although you and I haven't been talking about it in the past few minutes, I would add to that the challenges facing our colleges and universities, including our public universities, our community colleges. Many of them have been facing declining enrollments. How do we continue to provide access to quality higher education? There are big demographic changes that are challenging not just the publics, but the privates as well on higher ed. We need to be sure that we are providing opportunity pre-K through university level, and that is becoming more difficult to do in New York State. But it is a priority we should not retreat from. It's the best investment for people's future, no matter how you slice it, and you're not going to get it on the cheap.
He is the Comptroller of the State of New York, Tom DiNapoli, joining us this week on the Capital Connection. I'm David Gustin, now to a disturbing report. It's getting a lot of coverage, Tom, which is your report that says ambulance service EMS finances are a problem for counties and that funding for many EMS agencies is insufficient to cover the costs of operation. If there's one thing we want to be sure of is that the ambulance will get to us not only where we are, but in a timely fashion. What is happening here?
Well, a lot of issues, and I'm glad the report is getting coverage, as you point out. We used the word patchwork before. You look at the funding for emergency medical services, it's very inconsistent and inadequate in terms of the funding streams. It's very complex. Ambulance services are often not covered completely by insurance. And there have been a lot of issues. Staffing is another big issue. We've seen a decrease in EMS workers, and that's a concern. You need the staff to provide this very, very important service. Some of it in some communities is largely provided by volunteers. It's been hard to recruit volunteers in many communities.
Where are all these people going, Tom? Every place is looking for employees. Where are they going?
Well, if they feel the pay is too low and the work is too demanding, they're not going into these jobs, and that's a real concern.
Does that mean we need to raise salaries? What is happening?
Well, part of it, I believe, just from the perspective of our shop, because we're having issues, right? You mentioned that you ran into one of our employees at the SUNY campus that was trying to recruit SUNY students to consider a career at the Comptroller's office. Yeah, but David, isn't some of this related to the fallout from the COVID pandemic era?
I think so.
I think the attitude about work is very different. Younger people particularly have a different view, but it's a problem. It's a problem in, I think, well, certainly all state agencies and many workplaces. But here we're talking about emergency medical services. I mean, talk about an essential service. So what we really call for in the report, because part of the challenge is getting the data to analyze the trends, analyze the need, we would like to see the state really do a more proactive job and really accumulating the stats, working with the counties, because some of this really requires a regional response. This report was based on a survey that we had sent out to a number of counties in the state. So it really was a sampling, but I think there's more that can be done to really support at the local level, because it is a local service, right? This is not provided by the state, how we can really be more effective in responding. Recruitment is part of it. Adequate staffing levels, making sure people are trained, hopefully in those communities that use volunteer services, working with them to provide more incentives for volunteers to come forward. It's going to have to be a multifaceted approach.
All right, we're running out of time quickly, so we'll speed it up here a little bit. Hey, you did some village audits recently, and one that was at the top of your list was Saugerties. I saw that the mayor, Bill Murphy, was not happy with you.
Well, we found that they're in fiscal stress. That was, part of our report, which we really point out as an early warning system. And the good news is, when you look statewide, there are fewer municipalities in fiscal stress today than there were a few years ago. Part of that has to do with the infusion of the federal money, but there are some that still are in stress, and my worry is, moving forward, those numbers will start to increase again. But Saugerties was an example of a community we found that they've got some issues they've got to deal with, and we are there to be helpful to them in reversing that trend.
So no matter what he says about, well, it's not that bad, he knows he's going to work with your office to hopefully find ways to improve things.
We are available to do that. We can't compel him to do that, but we are available to do it. So you feel free to say to the good mayor, give DiNapoli a call. They'll try to give you a roadmap to better fiscal and budget position.
I think you just did. All right. Well, the percentage of New Yorkers with mental illness rose as available psychiatric beds decline. Now, that's as bad as the EMS report. I mean, we need to have places for all folks who need medical care, including those who are suffering from mental illness.
This is another area where, I give the governor credit, because she made clear that we have to do more in terms of mental health services, and she's putting money behind that commitment. But what our report really found is that the number of beds are certainly inadequate. We saw during COVID some of those beds were converted for use for COVID, and although there is the commitment to increase capacity, psychiatric beds, the pace has been very slow. So wherever you go in the state, issue of mental health, issue of homelessness and the connection between the two, issue of crime in some cases, I think everybody understands we have to do a much better job here. So hopefully our report will encourage, especially as part of the budget process, to be sure that we, in fact, are not only putting more money behind providing more capacity as far as beds to service those with mental health needs, but that when the money is there, we implement programs as quickly as possible so, in fact, we build up that capacity.
Well, you referenced public safety. We recently saw Governor Hochul asking the National Guard to patrol the subways. We've had some incidents on the subways, and there's an uproar, especially in the city tabloids, it seems like every week, about their condition and what's going on. Do you at your office look at the cost of something like that, public safety, in reference to specifically the subway?
Well, the short answer is yes. We do reports, audits on all things MTA, including those costs. But I think it'd be fair to say that it's not just New York City. It's not just the subways. I spent a lot of time here in the capital region. You see in downtown Albany a fair number of people that are on the street. I'm not suggesting that they're committing criminal acts, but we have had, fortunately, less right now because we've been coordinating with the state police and the Albany police. We've had some incidents not too long ago where some of our employees coming into work were being accosted. So, this is an issue across the state, and it is that connection between mental illness, homelessness, public safety. It's all three pieces.
Affordable housing.
Affordable housing is a piece of it. Lack of employment opportunities for some of these folks. Lack of services. It is a complicated mix made more complicated by the COVID experience that we're still trying to recover from.
The Comptroller of the State of New York. He's Tom DiNapoli. You are listening to the Capital Connection. I'm David Gustina. Well, sports betting. I'm wondering if there's any numbers coming in on New York. I see that once it opened up, New York jumped right in. We seem to like to gamble in this country. It's that sort of let's get rich quick mentality, isn't it?
Yeah, I don't have the latest numbers, but I can tell you that in terms of sports betting, it has exceeded projections, which is a little different than some of the other gaming opportunities. We've often reported on the casinos
Yeah.
coming in as expected, but sports betting seems to be, the exception where, in fact, it's exceeded expectations. Whether at the end of the day that's a good or bad phenomena, everybody will make their own judgments on it.
And what about cannabis? Now, we've seen a lot of criticism of the industry. They had to get a new person in there, the governor, to try to clean things up, get licenses issued, and it's taken a long time. It hasn't really killed the illegal industry. A lot of pot shops are open right now, and we've seen lawsuits as a result of the way the law was written. So are you in any place right now in the Comptroller's office to have any measuring capabilities of the revenues that are coming in from this now legal industry in New York?
I think it's too soon, really, to come up with hard numbers, and it's still evolving. And I think you're right. I mean, look, I don't know anybody that thinks the rollout has been effective at all. And I think it was for the governor to make very clear that it's just not working. So I think we have to give it a bit more time, because a lot of folks have said you should be auditing the cannabis rollout. Well, as you know, audits are not done overnight. And my worry was by the time we would get the audit done, the rollout would be many months, and the value of it may not be what people would think it would be. So I'm pleased the governor has acknowledged that this is not working, and let's give the retooling an opportunity to work, and then I'm sure we will take a closer look at it. But it's too soon, really, to have any hard numbers to be of any value for the conversation.
The Comptroller of the State of New York, he's Tom DiNapoli. We are unfortunately out of time. Tom, I really do appreciate you coming back again and again to talk to us about your role and about state finances and all things New York State, and we'll wait till the next time to have you on.
Look forward to it, Dave. We covered a lot of territory, but it's always great to be with you and your listeners.
The Capital Connection is a production of WAMC Northeast Public Radio. You can listen to The Capital Connection anytime at WAMCpodcast.org or anywhere you get your podcast. And join us again next week at this same time for another political conversation. For The Capital Connection, I'm David Gustino.
Support for the Capital Connection comes from New York State United Teachers, working to support students, educators, and public schools as the center of their communities through the Public Schools Unite Us initiative.